So now that we know a little bit about Giardia, we need to go on the manhunt. How are we going to find it? And the classic way for looking for Giardia is through a microscope of fecal samples. And we need to do our examination with a special zinc sulfate flotation, which is not the normal way we do flotations. If any of you have been involved in doing a little microscopy in your shelter, it's not the normal way we look for parasite eggs. So it's a special solution. The cysts are very small. They can look like yeast and are very delicate, which is why we need the special solution. Otherwise, we might not be able to find them. So basically, what it is, we need experienced personnel to look at these slides. Not just anyone can go with a fecal sample and go to the microscope and find Giardia. And the other really important point I need to labor is that even if we go and get the sample from the animal that's sick, they may not have cysts in the feces at that particular moment. We need to go and get another sample and another sample. And we recommend at least 3 samples over the course of several days, so we're screening multiple times to increase our sensitivity and likelihood that we'll find one of those cysts. So here's a brief, actually quite an unusual slide, now I'm thinking about it. The trophozoite, which is a fancy word for adult Giardia, and one of the cysts. And usually we're just looking for the cysts on the slide because the adults don't survive well in the environment. It's really the cysts that we're concerned with. So that just gives you an idea what they look like. And if you've ever looked for other parasites under the microscope, you might recognize some of these eggs. So we have the roundworm, the whipworm, and the hookworm. Massive compared to the size of a Giardia cyst. So if you don't know what Giardia looks like, if you're not looking for it, you can see how easy it would be to miss on a routine examination. So what other options do we have for diagnosis? Since clearly looking under the microscope, maybe not the best solution for everyone. Luckily, we have the magic SNAP test, and I'm sure most of your shelters have used SNAP tests, and it's just like all the other SNAP tests we use. It's looking for a special protein in the feces that's going to be present whether or not the animal is shedding cysts. So that's really great for us, and so it's much more sensitive. We're more likely to get a good result using the SNAP test. And there are other lab tests available. There's immunoassays and the PCRs, but for most shelters, this is what we're really going to be dealing with, is the microscope and the SNAP test. But just remember in the back of your mind, there are other options.